Good evening, everyone. You are welcome to week 4 of our online facilitation on NSC 508. This week, we are going to be treating Module 3. And I can see that we are just few that have been able to log in. So I'm going to give 5 to 10 minutes for others to join us. After that, I think we can commence the live class. But in the meantime, for those of us that have already logged in, I'm asking that we should kindly be patient and allow a few more people to join. Let's give them like 5 to 10 more minutes for them to join. Meanwhile, I would advise that we go through our materials so that we can participate in the discussion. Thank you. Okay, yeah. Once again, good evening, everyone. I think we can commence the class now with the hope that others will join us. As we progress in the class, I want to believe that we had a good day and we are settled for the class. Earlier on in the introduction, I said that we are on week 4 of our online facilitation, and we are on module 3. And module 3 has 4 units under it, of which we'll be doing unit 1 and 2 of module 3. So by next week, we would complete module 3. And module 3 title is Uses and Competency in Nursing Informatics. That is the title of unit 3. And under it, we are going to cover unit 1 and unit 2. Unit 1, it's nursing information competency. And unit 2 is informatics tools. And so we are going to look at these 2 units under module 3. And as our custom is, it is always good to let learners understand the learning objectives or the learning goal for the topic we are going to cover. So I'm just going to share the learning goal with us. The learning goal for this module 3, unit 1 and 2 is for learner to be able to identify and describe various competencies of nursing informatics, to be able to explain the meaning of nursing informatics competency, explain the available informatics tools and how to apply it. So far, those are the 3 learning goals. At the end of the facilitation today, students should be able to explain, identify all these learning goals. And so we have unit 1. Under unit 1, like I said, it's nursing information competency. And in this unit, we will discuss the following. Under unit 1 of module 3, we will discuss the following: informatic competency, which has 3 levels. It has 3 levels. And what are those levels? We have 1, beginner, entry or user level of competency. We have intermediate or modifier level of competency. And lastly, we have advanced or inventor's level of competency. Those are the 3 levels of competency we are going to be unpacking under module 1. And it is also important for us to note that each of these level of competency has another sub level of it. For instance, now, beginner, entry, or user level of competency also has 3 subdivisions or sub-themes under it. In each of this level of competency, we are going to be looking at the technical competency, utility competency, and leadership competency. Let's begin with beginner or user level of competency. What does it mean? So far, from the name, beginner, entry, or user level of competency, it simply means for nurses, it indicates nurses who demonstrate care nursing informatic competency. At this level is a stage where nurses indicate or demonstrate core nursing informatic competency, while the technical competency level of beginner entry or user level competency. What does it mean? I'm going to share my slide on that quickly, and it says, that nursing informatics, that nurses are expected to provide safe, competent, and compassionate care in an increasingly technical and digital world. And so, a user level of competency indicate nurses who demonstrate core nursing informatic competency. The user level competency indicates technical, utility, and leadership related skills and knowledge. And these skills and knowledge of the competency of a nurse, we are going to look at it from the technical competency, which is the use of information and communication technology. When you say technical competency, it simply means the use of information and communication technology. Utility competency, that is the use of automated information in a professional context, while leadership competency is the ability of the nurse to have decision-making with respect to planning for and using both the technology and information. At technical competency level, the user level technical competency includes the ability of the nurse to be able to do the following: demonstrate key part skills, use spreadsheet application, use telecommunication devices to communicate with other systems, use email systems to communicate with other healthcare professionals, use presentation application to create slides, display, or aids like PowerPoint, for example, what I'm showing you now. And the use of multimedia presentation, use internet resources to locate client supports and group online resources. And so far from what we have covered, we see that the beginner entry or user competency is an important aspect of nursing informatics, in the sense that we are in a technology world. From what we have been learning in this course, we see that everything is going in a technological way now. And as nurses, we can't afford not to follow likewise. What do I mean? We can continue to do manual things. And so the world is going electronically, technologically, and so the profession also is in that line. And so we will see that at technical level competency of a beginner, we have to be able to develop certain skills in technology. For instance, the use of keypads. You have to be able to use your system, your laptop, to present slides, to do PowerPoint presentation, send emails, and do the basic. And that is why it is called beginner entry or user level of competency. And don't forget that we have one. At the beginning, I said that under Unit 1, it has 3 competency levels. I said beginner, entry, user level of competency, intermediate or moderate level of competency, and advanced or innovator level of competency, of which each of these level of competency also has 3 sub-teams or 3 subdivisions. at each level. And what are they? We've just finished beginner level, beginner entry or user competency, which will look at the technical, the utility, and the leadership. And so far, are there questions before we move to the next point? Is there a question? Don't forget that this is a facilitation. This is not this is not a lecture. And so I expect your interaction. That is why earlier on, before the session, I've posted the PowerPoint instructional video, and of which I expect each and every one of us to have downloaded it and read through for you to be able to interact well in the live session of the class, please. And so we move to the next point, which is intermediate or modifier level of competency. And permit me, okay, I only understand the technical competency, ma'am. Okay, now we are moving to the utility. We just covered the technical competency. So we are going to move to the next one, which is utility competency. Utility competency level. The user level utility competency, further explained as the ability of the nurse to be able to recognize the relevance of nursing data for improving practice, recognize the limitation of computer applications, recognize need for continual learning in informatics skills, application, and knowledge, recognize the basic components of computer system. That is utility competency level under beginner entry or user level competency. Now we move to leadership competency level. At leadership competency, the user level leadership competency include the ability of the nurse to use computerized management systems to record administrative data, use applications for structured data entry, understand clients' rights related to computerized information. Lastly, incorporate a code of ethics in regards to client privacy and confidentiality. That is the three subdivisions under beginner entry user level of competency. Now we go to the second level competency, which is intermediate or modifier level competency. And what is it about? Before we even move to that point, can I have, is there any comments? If you have comments or question, please raise your electronic hand or put your question on the chat and it will be acknowledged. And so far we've just finished the first level of competency. We are moving to the second one, which is intermediate or modifier level of competency. And so we are going to unpack it under the sub-themes of utility and leadership, technical utility and leadership. And so we see that intermediate modifier level of competency indicates nurses who demonstrate intermediate nursing informatic competency. Technical competency at this level is the ability of the nurse to apply technology support to provide evidence-based practice, synthesizes data from more than one source and apply to practice, uses decision support system in practice. And we look at the utility competency under intermediate modifier competency. It says that the ability of the nurse to utilize multiple information resources for gathering evidence for clinical decision making, upholds technical standards related to data security, confidentiality, and clients' rights to privacy. And lastly, coordinate information flow with multidisciplinary team using information system. So we look at utility, we are moving to leadership competency, and it says that the ability under leadership competency it involves the ability of the nurse to have awareness of role of nursing informatics in the context of health informatics and information systems, evaluate security effectiveness and parameters of system for protecting client information and ensuring confidentiality, encourages other nurses to develop comfort and competency in technology use in practice. So we've finished unpacking intermediate or modifier level of competency, and we are on the last level of competency, which is advanced or innovator level competency. What does it mean? It indicates nurses who demonstrate advanced and specialized nursing informatics competency. This level includes practicing nurses, nursing administration, nurse researchers, nurse educators who have mastered expert skills and use technology in design, plan, coordinate the use of technology and informatics theory in nursing. And so we've just looked at different levels. We just looked at different levels of competency, and we've looked at the beginner, entry, or user level of competency. We've looked at intermediate or modifier level of competency, and lastly, what we just cover is advanced or innovator level of competency. And don't forget that each of these levels has sub-levels, which we looked at, which are the technical competency, utility competency, and lastly, we have leadership competency. And so, are there questions or contribution towards the first unit that we've just covered before we move to unit 2? Question, contribution? Okay, while you are typing your question and your contribution, let's move to the next unit, which is unit 2, and it is titled Informatics Tools. We want to see the various type of tools that is used in informatics, and I'm going to quickly share my slide on that to you, which is, okay, I'm sharing my slide. Okay. Okay, unit 2 under module 3, informatic tools. Nursing informatics can be examined in terms of theory surrounding data, information knowledge, and wisdom, as we have learned in under module 1 and 2, that nursing informatics is about data, information, and knowledge. And I remember under module 2, we unpacked, or we were moderated or facilitated on how data is being translated to information, and how information is translated into data. But this week, like I've said, this week we are going deeper into the course. So we are looking at the tools that we can use to translate data to information, and information to knowledge, and now knowledge to wisdom. That's what we want to look at by discussing informatics tools. And so I'm just going to highlight some points. I said nursing practice begins with the use of data that we are familiar with. More often than not, in most society, technology are being used to capture data. So you all agree with me that we are in era of technology, and almost all of us, we use technology. And even in the hospitals, technologies are being used to capture patient information for record purposes. And so good nursing practice require detailed record keeping that is comprehensive, timely, and accurate. Without competent recording, there is no evidence to prove that care was provided to the patient. And in nursing practice, there is a saying that what is not recorded has not been done. In fact, so poor record keeping does not only undermine patient's care, but makes the nurse more vulnerable to legal issue. And so, thank you for acknowledging that. If you don't document, we as nurses, we know how important documentation is in nursing. So if your care or your procedure is not documented, how do you tell me, or how can you prove that you did the procedure on the patient? And so record keeping is very, very important. It also helps to show the respect that we have for the patients, because when patient is able to know and understand that everything that is being done, it's being documented, it means that nothing can be denied. So we looked at these tools. We are going to look at these tools now. What are the various tools that is used in getting our data record accurately documented? So we looked at nursing and health data, which will be classified into 4 basic types. What are these 4? It's resources data. When we say resource data, example is the financial information, and we have patient or client demographics. We have activity data, that is the clinical data, and lastly, health service provider data. And so far, we've seen the 4 basic classification of nursing health data that we can have in nursing. And so, what are the various tools that we use to collect data? We have quantitative and qualitative data collection tools or instruments. And under qualitative and quantitative data collection tools, we use questionnaires, interviews, surveys, quizzes, assignments, email interviews, and web-based survey. These are the various instruments or tools that we can use. And so before I unpack this tool, let me quickly give a quiz. Learners, you need to understand that this is class, and you'll be giving quiz from time to time. So if I send a question, please try and respond and send your response or your answer on the chat, because there is a reward for it. You are going to be assessed, you are going to be marked. And all these quizzes and assignments will be added to your final exam. So quickly, for me to know that you have understand what we've covered so far under Unit 1 of Module 3, can you put on the chart the 3 levels of competency that we just unpacked? Don't forget, we have 3 main level of competency, and each of this level also has another 3. So I want those of us that we are live on the chat in the class to each write the 3 level of competency that we just discussed. I'm waiting to see on the chat. For those of us that we are live in this class, kindly put on the chat the 3 types of level of competency that we just discussed. I'm waiting to see it as we unpack the 2 we use in nursing informatics. Like I said, we use questionnaire, we use qualitative and quantitative. And under quantitative, we have questionnaire. That is the main, the most used tools that is used under quantitative. We have survey, okay. Yeah, 3 levels of competency: beginner, entry or user level, intermediate level, advanced or innovators, not inventors, advanced or innovator level of competency, correct? Okay, all right, correct. Okay, the next quiz now will be mention the 3 subdivisions of each of this level of competency. Thank you. All right, so as we were discussing that we have qualitative and quantitative tools, and each of these 2, that is the quantitative now, the commonly tools that is used is questionnaire, is survey. You can send your survey via email, and you have quizzes, you have assignments, and so on and so forth. Okay, technical utility and leadership, correct. Thank you so much. So yeah, okay, all right. Okay, thank you for your contribution. And so I'm just going to unpack questionnaire, which is the main tool that we are going to be looking in this unit. It says that a questionnaire is a data collection instrument, consists of a series of questions and other prompts for the purpose of gathering information from respondents. Questionnaires is one of the most popular form of data collection and can be administered in hard copy or on paper or programmed into a website where individuals may answer the questions electronically. It allowed collection of both subjective and objective data in a large sample of the study population in order to obtain results that are statistically significant, especially when resources are limited. The validity of data and information depends on the honesty of the respondents. And so we've just seen what questionnaire is. And for those of us who will be writing our projects very soon, that is the tool that you are going to be working with. At your level, you will do quantitative study. And in quantitative study, the tools that you will use is mostly questionnaire. You will use questionnaire. So I will advise and encourage us to please kindly download the instructional video that has been posted on the VLE. It's more elaborate, it's more explained than what we are having on this live session. And so please download it, listen to it, and read it. You will understand the details more. And so we have seen Unit 1 and Unit 2. And simply, I want to ask, what are the four classification of nursing data that we looked at under Unit 2? Don't forget, under Unit 2, I mentioned 4 classification of nursing and healthcare data. What are the 4? Can you put it on the chart? Let me set you up where I mentioned resource data. If you remember resource data, where I mentioned client patient data. So I've set you up, you can complete it. So I mentioned 4, kindly put it on the chart. And so far, that is what we have for under Module 3, Unit 1 and 2. For this evening, I want to welcome contribution or question before I do the conclusion, and we call it a day. Are there questions or contribution? Okay, while you are still typing your question and also responding to my last quiz for this class and for this week, I want to encourage us. I know that it's been busy for us, but I want to kindly beg us to please always download the PowerPoint instructional video. I can bet with you that it's more rich than the 1 hour live session that we are having. Read it, go through it. Another important announcement that I have is that each week I normally post assignment on the page. Please endeavor to kindly attend to the assignments. It's very important. It's going to be marked. Yes, thank you, Olufunsho. Yeah, the 4 classification of data: resource data, patient, client, demographic, activities data, health service provider data. Excellent. Thank you so much. Thank you. So please do your assignment. Each of the assignment has deadline. Please try and meet up with the deadline. The way I have set it, after the deadline, you will not be able to submit your assignment. And you know that it's also part of your assessment. Please do your assignment. Everything that I've asked is based, you can find the answer on the materials you have, either from the PowerPoint instructional video or from your course materials. So you find it there, find time, do your assignments. So Clara, please, which page? The VLE page, your school page. That is where you will find all the materials, including this live session that we are having. It will be posted there. At the end of the class, it's going to be posted there. Feel free to download your resources. All right, Ajayi, also thank you for your response. Okay, Francisca, thank you. All right, so any question? Okay. Silence to me implies is well understood. All right. So I'm going to share the last slide, which is the conclusion. Yes, conclusion. So in summary, informatic tools and methods from computer and information sciences are considered fundamental elements of nursing informatics. And the use of information technology distinguishes informatics from more traditional methods of information management in nursing. And so we've come to the end of the class, and I want to say thank you for joining the online or the live class presentation. And so at this time, we have done okay. So thanks for your comments. If there is no question or contribution, I think we can call it a day. But kindly, please download the instructional video, listen to it, and get yourself, do the assignment. Okay, I don't know why your name is not showing either. All right, so the assignment is very, very important, and also is also important for you to always check the materials and read it, please. The only way you can interact well in the live session is when you know what we are going to discuss. And that is why I normally endeavor at least 8 to 10 hours before the live class. I normally post, sometimes 24 hours before the live class, I normally post the PowerPoint presentation that we are going to cover. I normally post it. Please, let's try. I know it's been busy for every one of us, but let's make extra efforts to download our materials, go through it, so that we can have a more interactive session. I don't enjoy when I'm the only one talking. I don't enjoy it, because the essence is not for me to come and lecture you. It's for us, it's for me to facilitate the class, okay? To dilute the lectures. Okay. I didn't get how to dilute the lectures. Well, I'm not understanding you. I don't understand what you mean by dilute the lectures. Can you be more specific? What do you mean by dilute the lectures? Download the Mint. Okay. Please, I don't understand what you mean. So I'm not able to interpret what you are saying. Francisca, you said download she meant. Oh, okay. Now I guess. The instructional PowerPoint video is the course for the week, but in it, I've explained and I've shared the point there. It's more elaborate than the one that I'm sharing with you during the live session. And that is why I've been encouraging you since we started this course to always go through the PowerPoint instructional video before the class. Even after the class, please go through it, go over it again. You're not going to be asked something that is outside of what we are learning now. In the exam, what will come out in your exam is simply what we have discussed so far. And so, please go through your materials. Whatever you don't understand, bring it up in our facilitation and it's going to be explained. And so, if there is no question or contribution, I think we can call it a day. You enjoy the remaining days of the week, and I'll see you next week by God's grace, same time, same day. Have a blessed evening.